Welcome to episode 97 of the Inside Athletic Training Podcast. Today's guest is Dr. Christopher Camp, a board-certified orthopedic surgeon and the Minnesota Twins medical director and director of high performance. Dr. Camp also leads the Human Optimization Project at the Mayo Clinic, an initiative focused on maximizing health, performance, and recovery. We're excited to dive into his unique perspective on athlete care, research, and the evolving relationship between sports medicine professionals and athletic trainers. Enjoy the show. All right, Dr. Camp, welcome to the Inside Athletic Training Podcast. Extremely excited to have you on for episode number 97. For those that are unfamiliar with Dr. Camp's career and work, which we will touch on in a second here, he is currently the head team physician, medical director, and director of high performance for the Minnesota Twins. A ton of knowledge about research, surgery, all things injuries in baseball. Dr. Camp, again, welcome to the show. We really appreciate your time. We want to get started today by sharing your journey into orthopedics and sports medicine, and how you kind of landed working in professional baseball with the Minnesota Twins.
Yeah, well, first of all, Sam, thanks so much for having me. I love this podcast. I think it's phenomenal. I love the work you're doing. So I'm very happy and excited to be here chatting with you today. As far as my journey, I grew up playing baseball. I played other sports as well, but baseball was kind of the main love for me growing up. And I was one of those weird kids that kind of always knew that medicine was in my pathway. I kind of made that decision early on. And honestly, if you asked me in high school what I wanted to be, it was an orthopedic surgeon, sports medicine physician. I don't have any in my family. I don't know why that happened, but it just sort of did. I always loved science and loved baseball, so I kind of put it all together. So, after medical school and during residency, I kind of confirmed that, sports medicine is definitely the way that I want to go. Really fascinated with the shoulder and the elbow, really fascinated with arthroscopy, love teaching, love research, and love baseball. And kind of put all of those loves together. When I did my fellowship, I had the chance to work. I was in New York for fellowship, had the chance to work with the New York Mets and spent some time there, learning the ropes of kind of how professional baseball teams are managed from a medical standpoint from a lot of really great people. And I also did a research year during my fellowship, so I did an extra year of training specifically wanting to do baseball-related research. So had the chance to get the experience academically and then also practically in team coverage. After fellowship, came back to Mayo Clinic, which is where I did my medical school and residency training, took a job in the sports medicine division, so started doing surgery, knee, shoulder, and elbow surgery, no hip surgery for me. And then after a couple of years, got involved with the Minnesota Twins and started covering games, and things kind of expanded from there.
Yeah, I know it's a lot of work. Everyone knows to get to a position like yours. So extremely accomplished on your end. You talked about the coverage of games with the Minnesota Twins, and I know you've been involved in different sports throughout your career. With kind of three different titles, head team physician, medical director, and director of high performance. What does a typical week look like you during the Major League Baseball in-season calendar?
There really isn't a typical week. Every one of them is so different. And my roles are a little bit different and unique. So everybody's kind of familiar with the team physician role, which is mostly game coverage and helping make decisions about injuries. And then obviously the medical director role in baseball, as this audience knows, is relatively unique because you have the minor league system. And so my medical director role spends a lot of time trying to review minor league injuries and our overall plans, protocols, and help local team physicians and do all those sort of things. And then as a director of high performance, I'm involved in spaces beyond just the medical space. So not just our medical staff, but also strength conditioning and mental skills, sports psychology, massage, sleep management, nutrition, all of those sort of things. And really trying to link up what we do in all of those spaces across those groups. And then also trying to do some research and predict injuries, prevent injuries, all of those sort of things. So kind of linking the performance side with the research and analytics side is also a part of the hat that I wear. So my typical week involves a number of different things. So it's not surprising to anybody listening to this podcast. It's a lot of phone calls, emails, and text messages, which we all can relate to, I think. And it's also a lot, game coverage when the team is in town. So covering games along with my other partner orthopedic surgeons that do that. And then a few regularly scheduled meetings that I have, some with our athletic training staff, some with strength conditioning staff, some with front office staff, and then some with some of our researchers and development people. So it's a mix of all sorts of things. But I like that variety and I like that mix.
Sure. And do you find, during the season reviewing injuries, surgeries, working in the minor leagues, which is different than the head team position obviously would typically do, you have so much on your plate, but also kind of being proactive, like you mentioned, research, how can we prevent, what can we do differently, how can we innovate? Do you find that there's more time spent in the off season of baseball for you on the research side of things?
It does for sure. So it's busy year round, but the focus really shifts in the off season. So off season, we talk a lot about kind of year in review. How did things go? How did we do? What did we do well? What did we not do well? What do we want to change? What do we want to make a priority for next year? We always want to constantly iterate and constantly optimize, but you can't reinvent the wheel every year. So we try to think, all right, what are going to be our main focus points for this offseason and getting better next year? How are we going to help with offseason programming for people? What are we going to change up in our approach during spring training? How are we going to measure success? These changes we're going to make, how are we going to know if they're helpful or not? So we spend a lot of time in the offseason in doing those things.
Yeah, and one person you probably talk to in season, off season, every day is Nick Paparesta, who's the head athletic trainer with the Minnesota Twins, a man who is extremely accomplished. We just spoke to him last week on the podcast. So much history in his career from Oakland to Tampa and now Minnesota. What has your experience been working with the Minnesota Twins athletic training staff, and especially Nick, who kind of leads the staff there? Do you guys, talk every single day? Are you constantly texting? Kind of share with the listeners who might be into athletic training and not have much experience on the team position side, what that relationship between yourself and Nick, and kind of how across the league those relationships are so important to the player health.
We are in constant communication, so it is definitely a daily thing. Obviously, when the team is in town, I'm seeing them at the field, and we talk in person. And then when the team's on the road, some of that it's done by phone, it's done by email, done by text messages. So we have some standard ways that we go about it, which there's no one right way. But for us, we have a couple group threads of text messages that we communicate regularly on for player injuries and updates. And we have some of it that we do by email, and then a lot of it is done by phone call and FaceTime. So it's not uncommon that we're FaceTiming each other on the road and getting the player there and seeing us all interact and talk to one another. But it has been a tremendous blessing working with Nick and the rest of our crew in Minnesota. We've got some great people, and we have some incredibly experienced folks like Nick who've been in the game for over 20 years. And then also some that are relatively new, that have only been in the big leagues for a year or two. And honestly, I love having that mix, and I love having that variety. And I'm constantly learning from everybody. So that's one of the things that we have really tried to create in our culture with the Minnesota Twins, is that everybody can and should speak up. Everybody has something to contribute to the conversation. And so we want to constantly be asking each other, how do you view this problem? And what do you think are the answers? And what are you seeing here that I maybe am not seeing? No one person has all of the right answers. And so we know that we're much better, much stronger with the collective brain power that we have. So we're constantly going back and forth and bouncing things off of each other, and also giving each other a hard time professionally and personally, just to keep it light and keep it fun too. So baseball's a long season. It can be a grind. So we're constantly trying to inject as much fun and joy into the process when we can.
Yeah, absolutely. I think Nick's a great guy to do that with, for anybody that knows him.
Yes.
Dr. Camp, I know you mentioned everyone has a voice. Everybody, whether young or old, senior, junior, is important to the staff in Minnesota there, much like across the league. That said, we've talked to a lot of our members, more senior and experienced athletic trainers, about getting into a meeting with the team physician their first year, being a little intimidated, trying to find their way, but not necessarily wanting to lay too far back and really want to have an impact, but don't want to step on anyone's toes. How do you find you manage that, being in charge of so many people working down in the minor leagues? how do you provide people with a voice and make sure they're confident that when they have information, they can come to you and not be intimidated in your office?
That's a great question. And I think there's a lot of approaches. So first, I would say to that person who maybe thinks, oh, this is my first time doing this, I'm a little nervous or a little apprehensive. That's normal. That's okay. And in fact,
Sure.
that's probably appropriate. If you go in, if you're fresh out of athletic training school, you're day one on the job, you're not going to come in and tell everybody how to start doing things.
Yeah.
And so a little bit of apprehension is a normal reaction. So first of all, if you think, oh, I'm a little nervous, I'm a little apprehensive, that's okay. That's normal, and that's probably the most appropriate way to feel. So that's step one. Step two is now you say, okay, now how do I push through that and not let that hold me back? And the easiest way to do that is, number one, be prepared. Figure out as much as you can, think as much as you can. And then number two is just do it. The more you do it, the less uncomfortable it will be. And really, when we are approaching any activity in life that's uncomfortable, there's always a tendency of us to hesitate a little bit and not lean into that. And when we do that, that thing just becomes more and more uncomfortable the longer we let it build and the longer we avoid it. But the more you lean into it and the more you do it, the more comfortable you become. And that becomes very normal. And you probably won't nail it the first time. That's okay. You're going to take whatever you do. If you mess it up, take that as feedback, make an adjustment, and then do it again and do it again and again and again and keep iterating. So I think those are a couple of things that I would say. Number one, just recognize that feeling a little nervous or apprehensive is perfectly normal. Number two, that doesn't give you an excuse to not do it. So go ahead and do it anyway. And then I think for me, from my perspective, actually, one of the things that I try to do, it's really challenging because, our organizations keep getting bigger and bigger and bigger, is that I want to try to get to know everybody and I want to be around. I try to make the rounds during spring training. I spend time in the major league side and the minor league side, and I go into the weight room and I go into the training room and I go out on the fields, and I just want people to be familiar. I want people to be comfortable, and that can be a really challenging thing to do. But I think the more time we spend with one another, we start to break down some of those walls and barriers a little bit, and then hopefully that makes others feel more comfortable, like they can speak up. And honestly, I feel the same way with the players. And I think this is something for all the athletic trainers out there is I want the players to see the physicians and the medical staff even when they're healthy. You don't want them to just associate you with pain and injury and surgery, right? Because then you have this negative sort of Dr. Doomsday kind of like, oh no, the doctor's around. This is terrible. Something bad's happening. So I really try to make a point to get to know the players when they're healthy and when they're doing well. So that way you're just a part of the team, and then they're going to feel more comfortable coming to you when they are hurt. So I think those are a few different perspectives on that issue that hopefully will be helpful for the audience.
Yeah, no, that's very interesting. And with that, being part of the team, you want to just fit in, just like people, in the clubhouse. You don't want someone to associate you with negativity constantly, like you said. With that, are you doing any traveling with the club during spring training? Are you visiting there? Are you visiting minor league sites to kind of also have that impact, but make yourself familiar to players at all levels?
Yeah, and I think every team and organization does this differently. There's a lot of ways to do it successfully. For us, our docs from Minnesota actually do travel down for spring training. So for me personally, I make 3 trips down for spring training. So I'm there for major league physicals at the beginning, minor league physicals in the middle, and then the last week of spring training. So I make 3 separate trips for spring training. During the season, I obviously don't travel with the major league club. We just cover home games.
Yep.
And then the visiting team physicians takes care of them, unless we're in a playoff situation, which hopefully that happens a lot. Then we do travel for playoffs. Other travel for me involves I do go down to our spring training facility after the draft to do physicals for our drafted players. It's kind of a good chance for me to get to meet them and welcome to the organization. Sure. Travel to the combine, winter meetings. I may get down to our Dominican Summer League Academy, usually a couple times a year for entry and exit physicals. And I do try to make it to most of our minor league sites once a year, every other year, usually to do some physicals, check in on players. But it's nice just to be around. And that's part of, I want to know what the facilities are, know what the resources are, check in to see how our athletic trainers and strength conditioning coaches are doing, how the coaches feel like everything is happening, have the players see me, in that environment as well. So
sure.
That's most of the travel that I end up doing.
Mm-hmm. Yeah, definitely a little less than your counterparts in the athletic training staff who are there every step of the way. Not saying it's any less of an
Right.
impact on your end. Well, Dr. Camp, one thing you mentioned, which I think is super interesting in being involved with PBATs and all the men and women in the society, is the relationships between the athletic trainers. Not in a competitive way, but in a helpful way. I found my almost 15 years of working with these people is they take pride in their visiting room, in how they take care of the visiting teams, what they can do to help out. It's really a unique kind of friendship and fraternity there. Talk about injuries on the road and your relationships with other head team physicians. For example, if the Twins are in Baltimore and there's an injury, are you discussing that with Sean Curtin of the Orioles? Are you calling Nick instantly? Are you watching every second of the game to see those injuries? What's that process like if there's an injury on the road and you're not with the team?
I think that depends a little bit on sort of the comfort level of the athletic trainer.
Mm-hmm.
And I think it depends a little bit on the relationship between the athletic trainer and the physician. And also depends a little bit on the severity of the injury.
Sure.
I would say for us, I've had the chance to work with Nick Paparesta, who's our head athletic trainer for several years now. And he has my complete and total trust, and I have total faith in him that I leave it up to him to let me know when he needs my help. So, and oftentimes, if it's a bigger injury, they'll ask that the team physician reach out to me and let me know, or they may just communicate that to me as well. But ultimately, they're the ones that are the boots on the ground. They're with the players day in and day out. And so I feel like they have the best pulse on that situation. So they're the ones that kind of let me know when I need to get involved and to what level.
And we talk a lot about injuries on this podcast. I mean, it's not the entirety of what an athletic trainer does, but it's very important proactively to prevent and to take care of the players and just make sure they're on the field. I want to talk to you a bit about a couple pieces of research. First, in 2024, Major League Baseball released a report on pitcher injuries, talking about the rise in injuries, interviewed quote unquote 200 experts from all areas and all levels of baseball. That could be athletic trainers, strength coaches, team physicians, players included in that. And we found, from the data, which, people can interpret how they want, just the rise in pitchers' injuries. They talk about max effort training being a huge issue, just warehouses of pitching factories for younger kids. Things have changed so much in the game. What was your take on their report, and just kind of the overall theme of the injuries with pitchers becoming so frequent, and kind of how you guys approach that?
Yeah, several thoughts there. I had a chance to be a part of that process, which I think I commend Major League Baseball for really trying to take the time to dive into this.
Sure.
It's obviously a huge problem in baseball. We're all familiar with it. And I think doing the best we can to be proactive about it is wonderful, but it is a massive challenge, and it just keeps getting harder every year. I think, the main findings from that were that some of this chasing velocity and this high level training is contributing. And I do think that's true. If you look at all of the data that was published in that report, as well as really the world's data on pitching related injuries, and we've done a few systematic reviews on this, you can really kind of bucket risk factors for injury into three main categories. Is it elbow injuries in pitchers? Three main categories. One is throwing with poor mechanics. Mm-hmm. The second is throwing too much, so too much volume of throwing. And the third is throwing with increased velocity, or now we would say velocity and spin rates or different pitch metrics. Yeah. So there are thousands of things we've looked at, but really you can kind of organize them all into those three categories. And I think that report showed us that, yes, the velocity and spin rates are a huge part of that. And when I think about this, it's a massive problem, but I try to simplify it into those three categories. And that really helps me when I'm counseling patients and players. And if you think about like how we're going to make some strides and improve this, if you think about it at the youth level, we can really target all of those things. So the mechanics are a major concern. You've got kids throwing out there, they're doing it with very poor form and technique and putting themselves at risk. And then obviously many of them are throwing way too much with, year-round pitching and playing on multiple teams, playing back-to-back days. So both the mechanics and the volume are an issue there. Velocity and spin rates are a risk factor at every level, for our youth, our high school, college, and professionals. But we have to recognize we're probably not going to change that, right? Because velocity works and these pitch metrics work.
Yeah.
And so if we try to tell them to not do it, they're not going to listen. So we as medical people, we have to just accept that. Velocity is up and it will keep going up. Spin rates are up and they will keep going up. So we have to look at these other things. We have to look at mechanics and we have to look at throwing volumes to really try to move the needle. And I think for our youth athletes, you can look at both of those. For professional athletes, the mechanics are fairly well tuned up. You know, you're not going to make some major mechanical changes to a major league pitcher that's really going to improve their injury risk. So it's probably got to be a volume mitigation thing. So in my personal opinion, if we ever really want to try to make some headway on this, it's going to have to be on the volume side. And I think that's challenging because roster sizes are fairly similar. There's always 162 games, and every one of them is 9 innings. So there's a standard number of games or standard number of innings that have to be thrown by somebody. And you only have so many pitchers to distribute those innings across. And each of those pitchers is throwing harder than they used to. So that is the challenge. And so I think if you look at it and you think, well, if somebody asked me, hey, how can we really make a difference at the major league or professional level? It's, well, we have to find a way to dial down the volume. How do you do that? Do you reduce the number of games, reduce the number of innings, increase the number of pitchers? I mean, those things would probably help, but those are some big changes. You know, you're talking about changing the nature of baseball, which obviously is very complicated and problematic. So there are a lot of layers to this problem, and we're going to keep battling it for a long time.
Yeah, very, very interesting insights from you there. And, you know, one thing I'm extremely interested in, and so is membership of PBATS, is youth sports specialization, specifically in baseball. And how that creates many issues that you mentioned. So we had Jamie Reed, longtime Texas Rangers medical director, head athletic trainer, legendary PBATS member, on the podcast a couple of months ago, talking about youth sports specialization based on the information from this report. And Jamie showed us, and I'm interested to get your take based on your location in Minnesota. Jamie showed us kind of a heat map of arm injuries from players who were drafted from different states across the country 20 years ago versus today. And back in the day when, you know, you were throwing in Minnesota, that ended in the summer. It's too cold. You can't be outside all day playing baseball. Now, more recently, the pitching warehouses and factories and things like that have come up, and people are throwing year-round nationwide. And it kind of has evened things out of arm injuries and Tommy Johns from people in different, you know, colder states. And Jamie mentioned that back in the day, people may have drafted more pitchers from Minnesota and Wisconsin because there's less risk there, all dependent on skill and development, of course. What's your take on that, kind of being someone who works in Minnesota, and kind of the uptick of showcases, perfect game, velocity meaning so much, pitching warehouses? What do you kind of feel on that topic?
Yeah, I definitely think that those geographic boundaries are starting to blur. No question about it. And now there are, you know, I live in a spot where it's very cold in the wintertime. You can't get outside. High school season starts a little bit later. But these kids have access to indoor throwing facilities. Many of them will travel. They have no problem traveling to warmer states to throw. So they have definitely found a way to work around the weather concern. So now volume. Too much volume is an issue universally, and it's sure probably slightly dependent upon climate, but much less so than it was in the past. So we're absolutely seeing the same issues and the same increases in these northern climates where it's cold, and it's becoming, I mean, one of the most common things that I'm seeing in my clinic all day, every day are these young athletes with shoulder and elbow problems from throwing so much.
And is there, you know, a general guideline for parents or listeners out there who may have young kids getting into baseball, whether it's, you know, very young or heading into high school? Are there guidelines you guys adhere to or recommend for younger pitchers, say middle school, high school ages, even if they're, you know, chasing velocity or want to improve, like we want everybody to strive to improve? But what do you guys kind of give as guidance for those patients?
Yeah, in big picture, I talk about several things. One, I do think the pitch smart guidelines are good. They're not perfect, but there's never going to be a set of perfect guidelines. It's the best we have now. And Major League Baseball is currently working on partnering with USA Baseball and a couple other groups, and they're going to update those pretty soon. So we're actually in the process of doing that now. So we're going to keep iterating and improving those. So I think that's a great reference that needs to be taken into consideration. I also think the importance of playing multiple sports cannot be understated. And for a few reasons, actually. So, obviously, I think mixing it up and playing other sports is immensely helpful for reducing injury risk. No question. That's pretty clear. It's also helpful in increasing the overall athleticism of kids.
Sure.
That's very clear. A third point, though, that people often miss is that it also allows kids to enjoy the sport for longer. One of the issues that I see very commonly in my clinic is that these kids that'll go all in on one sport, whatever it, baseball, basketball, football, soccer, doesn't matter. If they go all in and they play it year round from an early age and they spend all of their time doing it, there's still a good chance that they're not going to play that sport professionally.
Sure.
And when they hit the end of their road, whether that's the end of high school or the end of college, oftentimes those kids will have a very negative relationship with that sport or their parents who push them to play it so much. And I see it all the time. And so I honestly think if you want your child to grow up to hate the sport or hate you as a parent, one of the easiest ways to do that is to make them play it more than they want to. And so those are some other psychological things that are probably far more important than elbow injuries that people need to be thinking about. So even from a psychological standpoint, I think it's immensely helpful to mix it up for the kids. So those are some things we talk about. I do think that for that reason, I recommend that every kid take at least 2 months off of their sport, whatever sport that is, whether it's swimming, tennis, golf, baseball. Try to have a period of at least 2 months during the year where you're not playing that sport at all. And one of the things, obviously, it gives the body a break, which is fantastic, but it also gives the mind a break a little bit. And my daughter's an avid tennis player. She loves it. She wants to be very competitive, but I really want her taking at least 2 months off because then what happens is after she does that and then she comes back and starts playing again, she comes back with a renewed hunger.
Sure.
And she is passionate about it and she loves it. And so it is helpful for her and it pushes her further to have that break. And then she actually ends up getting more out of the year if she has a couple months off, because the other months when she is playing, she has much more enthusiasm and eagerness for it.
Yeah, and I think we've talked a lot about this on this podcast with members is sports specialization for all those reasons you mentioned is just so important to avoid for all of the physical aspects, but like you said there, great insight from you on the mental aspect as well. Well, Dr. Camp, I know we mentioned the Major League Baseball report on pitcher injuries. You also have some interesting data on the outcomes on Tommy John repair, internal brace, standard reconstruction, some more details there that I think our listeners would love to hear more from you on that.
Yeah, so I'm sure our listeners are all aware, Tommy John injuries continue to go up and up and up. And so as a result, surgery numbers keep going up and up, and the data is pretty clear on that. And one of the things that's been interesting in the last few years is that we've developed some newer procedures. And so a lot of the audience is probably familiar with this, but I'll run through it real quickly. So traditional Tommy John surgery is a reconstruction of the medial ulnar collateral ligament on the inside of the elbow. Recently, we've been talking a lot about repairs, which is where we sew down the athlete's current ligament. So we just fix it in place without adding a new one. And historically, those did not do well. But in recent years, we've been adding an internal brace, which is this suture tape to it. So internal brace repair has gained popularity. And then much more recently, within the last few years, we've actually been adding those internal braces to our reconstructions. So now we really have three categories of Tommy John surgery. So there's the repair with the internal brace, the standard reconstruction where we add a graft, and then there's what we call the augmented reconstruction, which is a reconstruction with an internal brace.
Okay.
And so those are kind of the three big categories. And we've been doing these now for those of us that were early adopters to the augmented reconstruction, really started doing them probably around 2018. So we're starting to get some data back on these now. That's been really helpful. And we've got some studies where we're comparing these. And one of the concerns with the repair and internal brace is that, well, actually, first, the benefit of it is it generally has a faster recovery, which is wonderful, tremendous. We all love that. So that's the big benefit of doing the repair with the internal brace. There was some concern, though, that those might fail at a higher risk or at a higher rate than the standard reconstruction. And what some of our early evidence is showing is that that's not necessarily true. There may be a slightly higher failure rate of the repairs, but it's only by a couple percentage points. So it's pretty small. It's like a 7% versus 9% risk of failure. So it's not that dramatic. But the ones that do fail tend to fail faster. So if we look at the average time to failure for a repair with internal brace, it's about 14 months from the initial surgery. So the failure rate is low, but if they do fail, they tend to fail a little bit faster compared to the traditional reconstruction, which has a low failure rate, but the average time to failure is usually around 4 years or so. What we're finding with the augmented reconstructions, so the reconstruction with the internal brace, is that it's sort of in the middle. So it's a slightly faster return time than a standard reconstruction, slightly slower than a repair. It has a slightly lower rate of failure, and if it does fail, it seems to take a lot longer. So we're starting to tease out some of the differences in these, which are really helpful. So just to summarize that, the repair with internal brace tends to get players back a little bit faster. Usually at higher levels, it's around 9 months or so for our high-level pitchers. The failure rate is low. It's probably somewhere around the 9%-ish range, but the time to failure is kind of quickish. It's around 14 months. For the new reconstructions with internal brace, failure rate's low. It's probably in the 5 to 6% range, and the time to failure is much longer. It's around 4 to 6 years. And then the getting back to pitching is a little bit faster, and it tends to be around 10 to 12 months. So there's trade-offs, there's pros and cons. I think there's indications for each of these kind of depending on the player, depending on their goals and their timeline and their career stages. So I think we're probably going to see all three of these options stick around for a while. But we're actually really seeing almost an explosion of these augmented reconstructions within the last several years. And in 2023, so just 2 years ago, a third of all Tommy John surgeries performed in professional baseball players were augmented reconstructions.
Wow.
And just 5 years ago, it was almost none. So it's exploding pretty rapidly.
And within your field, Dr. Camp, that's extremely interesting. Within, the people you talk to who are other, team physicians across Major League Baseball, how does kind of the innovation for these surgeries, how does that spread? Is it, for example, someone has a couple that are very successful, limits the risk of repeat injury or the rate of how fast it happens, and then, you speak to each other and there's research. How do kind of these changes made? Because this is all happening so fast. In the past, it was standard reconstruction. We know internal brace is extremely popular. Dr. Keith Meister in Texas doing a ton of those, speaking about it a lot. How do these innovations get to your office? How do you hear about things like this within the field that you're in?
They expand in a lot of different ways, some good, some not so good. So the ideal way to do it is that you have some folks that spend a lot of time thinking about it, talking about it, who kind of get together and say, hey, we've noticed a problem. We need to come up with a solution to fix it. They come up with a solution. They go into the lab. We test it. We do different research. We do cadaveric studies and biomechanical testing. We say, okay, that looks good. Now let's try it in some lower risk situations. So maybe try it in some non-throwing athletes first, or they're having good outcomes. Okay, now let's do some lower level pitchers, see how that goes. Okay, they're having good outcomes, and then we kind of build it up to the higher demand, higher stress pitchers. And then we research and a few people kind of do it, and we say, okay, let's research it, make sure the outcomes are good. If they are, then we publish it, and then others can adopt it. That's kind of how you want it to happen. But in reality, sometimes these things get pushed a little bit fast by industry and other companies that are making money off of the products and things. And so there's a lot of advertising, a lot of marketing, or sometimes you have one or two players that have a really good outcome with one type of procedure. And this is true of everything, not just Tommy John surgery. One or two players have a really good outcome after one procedure, so they become very vocal advocates, and then it really kind of takes off after that. Or you maybe have agents that have a client that had a good outcome, so then they're pushing for it in others. And not to say that that's bad. You definitely need to think about those things and weigh them into the equation. But In reality, if we base decisions off of what we're going to do for hundreds of people based on the outcomes of one or two, it's not always an apples to apples type comparison. So ideally, we'd like to have some research to kind of back up the things that we're doing, and we're getting there with the Tommy John world. The problem though is that we keep innovating, and we're making stronger constructs that are biomechanically stronger for Tommy John surgery and biologically more friendly, meaning they can heal a little bit better. And we're improving our rehab protocols and techniques. We're constantly iterating on all this stuff. But while we're doing it, our pitchers are going back to a game that requires them to throw harder and train more than it did when they got injured. And so it's a bit of an arms race. And we're doing everything we can to innovate on our side. But so are, all of the talent producers out there that are innovating on their side, and they keep getting guys to throw harder. So we're up against something that's it's pretty tough and it's pretty challenging. So I think we're going to be locked into this battle for a while.
Yeah, very interesting just to hear your perspective on that. And there's so much that goes into when you hear a Tommy John surgery, for the listeners out there, there's a lot more that goes into it than, surgery, rehab, back on the field. And you and your staff and athletic trainers across the country do such a great job in that rehab process. I did want to talk about that a bit. When you do when there's a Tommy John on one of your guys, how do you guys manage the rehab process, both for your athlete physically, but more importantly, kind of want to talk to you about the mental aspect of that. So, you know what you're doing, how to get them back on the field. You work with Nick and his staff, to lead them in that direction. But mentally, it's such a long road to recovery. There's got to be question marks from athletes of, is this going to hold up? What's the risk of re-injury? When a player has surgery and the elbow's repaired, how do you work on that mental process with them in terms of return to play?
It's a huge part of the game, and honestly, research has shown that players have apprehension and they have nervousness about it and some trepidation when they return, which is normal, and that's okay. That's true of ACL surgery, rotator cuff surgery, Tommy John, any surgery. And that makes sense. So we try to talk them through that, and honestly, in an ideal world, that's best done before they get injured. So and when you're in an environment where you have the resources, it's nice to have all of your athletes plugged in with sports psychologists and mental skills coaches when they're healthy.
Sure.
So that they have established those relationships with those individuals. So then when they get injured, they know who to go to. And then you're not starting a new relationship at that time. So that's the ideal situation, is that they know them beforehand. Then when they have the injury, say, okay, we're going to keep working through this, and we're going to get some experts in here to help you. That's not always the case, though. Sometimes they don't know. So we've actually tried to incorporate it as a standard part of our return to play process, that this is just another thing that we go through. We're going to check your range of motion. We're going to check your strength. We're going to check your stability and all these other metrics. Other things we're going to check off the list is that we're going to have you meet with the mental skills team and the sports psychologist, and we're going to have you meet with nutrition. And we just try to normalize that as much as possible. Okay. This is just a part of the return to play protocol. This is just standard. We do this for everybody. We're not saying that there's something about you that makes you specifically need this. Everybody needs this and does this. So I think trying to normalize it as much as you can is really helpful. But the role that our mental skills coaches and sports psychologists play, we're fortunate. We work with Premier Sports Psychology, which is a group based in Minnesota. And they are tremendous, and they have been incredibly helpful for our athletes when they're healthy and when they're injured. Mm-hmm. And so we have integrated them into our organization, and so they're just another member of the team, and people recognize their name and their face, and that has been immensely helpful for us. So it's a standard part of our procedure. And I think in addition to that, I have to give a ton of credit to the athletic trainers and the physical therapists that are working with these athletes, because they know the athlete, they know their personality.
Yep.
Oftentimes, they play the role of a sports psychologist and a mental skills coach, and that's true of our strength conditioning coaches as well. You could say, all right, I can tell something's off with this guy. This is abnormal behavior for him. And a lot of times they're the ones kind of, walking them through and keeping the guardrails on and trying to keep them safe and redirecting them and encouraging them and doing it too. So everybody wears that hat a little bit throughout the whole process, and we wear it as the surgeons. So we need our athletic trainers, our physical therapists wear it, and honestly, our pitching coaches wear that hat a little bit as well. So I think it's critical for all of us to be on the same page, meaning the coaches, the medical staff, S&C, and sports psychologists, we all have to be on the same staff. So we're presenting a consistent message to that athlete and help them get back.
No, really, really interesting. I love hearing you speak about your proactive take on first yourself being around the players. You mentioned earlier, you show up, it's doomsday. You don't want that to be the case, but also here is preparing players, especially the younger players who, are trying to carve out a career and a place in the league that, hey, you could be injured. We're not here to say you're going to get injured, but we want to prepare you. Have everything we need if that would happen to make it a more comfortable thing for them mentally. I think that's really amazing and something unique that I don't think a lot of our listeners probably have heard or thought about. We've talked a lot about Tommy John surgery and its importance and, part in the game, which it is, unfortunately. You do have you're very passionate about research and you do have new data that you're working on injuries in baseball. So I'd love to hear kind of the things you're working on research-wise in the game of baseball.
Sure. We have a lot of stuff we're doing related to Tommy John type injuries, and I mentioned some of the highlights of that already. Another big study that we're working on now is just reviewing the Major League Baseball hits database just to provide an updated epidemiologic report. We published one several years ago that looked at injuries from 2011 to 2016, and now we've updated that through 2023. And so we're in the midst of finalizing that. So hopefully we'll have it out for everybody to look at here within hopefully within this calendar year is the goal. But it's interesting to see, some of these old culprits that we all know still end up being the most common problems that we struggle with. So I can run through, the top injuries. It was number one, hamstring strains. So still at the top of the list. Okay. Second, rotator cuff strains and tendinopathy. And third, no surprise, oblique and rectus strains.
Sure.
Fourth most common, ankle sprains. Fifth most common is back spasms and back muscle strains. And then shoulder impingement. And then number 7 on the list is medial ulnar collateral ligament injuries. And number 8, forearm flexor strains. So it's the same usual suspects that we see. And the one responsible for the most time out of play is the hamstring strain, just because it's so common. Mm-hmm. And then obviously the biggest surgical problem is the medial ulnar collateral ligament. So those are the big ones that we face. They continue to be a problem. Surprisingly, though, injury rates are up, but probably not as dramatically as people think they are, which is really good news. We always feel like it's worse than ever, but that's not really the case. If you look back at the data kind of from 2012 to 2017, like that, roughly 6 years in there, injuries in professional baseball were roughly around, mid 6,000 per year, like 6,400-ish per year. And then there was kind of a bump around 2017 through now. But really, if you throw out 2020 because of the COVID year, we've stayed fairly consistent in the low 7,000s since 2018. So we look at the number of injuries in 2018, it was 7,224. Fast forward to 2023, 7,212. So almost identical between 2018 and 2023. So overall, I think when you look at that data, we're actually doing maybe a little bit better than we think. Now, there are certain types of injuries, specifically elbow injuries and hamstring injuries, that seem to be up and high. So those get all of our attention. And it's very natural to kind of have this, oh my goodness, we're never going to win. This is a hopeless cause. We should give up sort of mentality on this. But overall, I actually think there's some encouraging data out there that shows, hey, we're actually managing some of this reasonably well. And if you look at our average, time missed per injury, that's actually down a little bit compared to the last several years. So overall, it seems like we are making some positive strides. So I think that there is reason for hope. I tell my patients all the time, when you have a bad injury, like, it's okay. You can be mad, you can be angry, you can be frustrated, you can be annoyed, but don't lose hope. I tell my patients this all the time. And honestly, I'm going to tell all the athletic trainers listening out there, like, yeah, you can be angry and frustrated, but don't lose hope. There are some areas where we're winning out there. So stay encouraged and don't give up. Keep fighting a good fight.
Yeah, that's fascinating. For everyone out there listening, there's so much that your staff and Nick, as the head athletic trainer, have to worry about in terms of injuries and how much they play a factor in really a grueling 162 game season. So it's kind of cool to hear you shed some light on injuries and how it impacts the game, and again, the positivity that you've mentioned over and over again. The mental side is just hugely important. And Dr. Camp, well, I want to shift gears a bit. One thing, you want to help encourage people to stay positive, to be proactive, to prevent injuries. You're working on a really cool project at the Mayo Clinic called the Human Optimization Project. Super interesting podcast. Encourage everybody to listen, and then we'll talk where they can find the show in a bit here. Talk about the basics about the show, how you're working to share with listeners about optimizing human performance, and really what inspired this initiative, seeing as you're incredibly busy working with the Minnesota Twins and everything, but you still find time to kind of put this information out for people.
Well, the inspiration for it came, obviously I'm very busy with the Minnesota Twins and I love it and I'm passionate about it. My heart lies there, but I'm also, an orthopedic surgeon who's busy doing things there. I do a lot of research, do a lot of teaching and education, and I've got a family with 4 kids, amazing kids. They're all playing sports. They're super busy and doing things. And so look at it, life is busy everywhere and everybody feels that. And the bar for performance is higher than it's ever been for all of us. I don't care who you are or what your role is. What you're expected to do now is more than people were expected to do 30 years ago, in that same role. And it just keeps growing and growing and growing. So we all feel this pressure to do more and more and more. At the same time, we're recognizing the importance and the value of sleep, rest, recovery, wellness. So people are saying, wait, you're supposed to do less. And so we feel like we're supposed to do more and less at the same time, and our heads are spinning and they're ready to explode. And so that's the question, is how do you do more and less at the same time? And that's really what human optimization is about. It's allowing you to try to achieve as much as you possibly can while also improving your wellness and well-being. And one of the problems is that we often think about these different domains of performance independently. So we think about sleep on one hand, and then we think about our productivity on another hand, and we don't recognize how connected they are. So the way the Human Optimization Project is designed is it's designed to kind of pull all of those things together and all of the main domains of human performance. And so we have it separated out into 10 different domains, some of which are physical, some of which are more cognitive, but they're ultimately all linked. And so our goal is to try to tie all this together to get everybody to see how you're, as a human being, you're not just the results of your leadership skills, or it's not just about how physically fit you are. In order to be the full package, you got to put all of these different things together.
And in your experience of sharing this information with the public and feedback you've gathered, do you find that there are, for example, people talk about sleep all the time. There's thousands of books and leaders talking about sleep. Do you find that there's, of your 10 key domains, one that people are more focused on, even while you're trying to bring them all together? Do you think you're needing to encourage your patients and your listeners that, hey, all 10 of these are extremely important and are related to each other? Do you kind of think there's a less of a focus on certain aspects than others when it comes to optimization of human performance?
Yes. So we all have this expertise or performance bias. And so we tend to be people that if we're really good at something, we tend to think that that thing is the answer to everything. And you can think about this in your own life or other people. So let me mention, so the 10 domains that we talk about on this project are sleep, exercise, nutrition, physical health, productivity, wellness, cognition, leadership, personal growth, and social and interpersonal skills. And we can probably all think of people that are experts in one of those areas.
Absolutely.
And oftentimes, like if you know somebody who's super social and has amazing interpersonal skills, that is their answer for everything. And that often will compensate for a lack of leadership or a lack of physical health. And so they'll just lean into the thing that they're really good at and then think that's the answer. And also, I have other people that I know that are unbelievably dialed in on their nutrition and are just like the healthiest eaters on the planet. I'm not talking about myself here. I'm talking about others. And they're so dialed in. But one of the problems is that they become a little bit biased, and then they think nutrition is the answer for everything. And so we all tend to develop this domain. If we become an expert in a domain, then we get really biased and we think it's the answer for everything. So that's one of our problems. The other problem is that if you want to improve in an area, so let's say you want to improve your productivity, okay, then there are these classes, books, podcasts, whatever that you can listen to that are focused on productivity. So you can spend time doing that, but you end up doing it in isolation. So then later, if you say, okay, now next I want to work on my sleep, okay, you have to completely shift gears and go say, okay, now I got to go find new material. I got to go talk to somebody else, listen to a new podcast, read a new book, watch a new TED Talk, whatever. And so these things are not connected. So that extra effort that you have to make to switch gears and go to a different location and a different place and a different set of resources, that's enough friction that it keeps most of us from doing it. And we just say, you know what? I don't want to spend all my time figuring out how to get better at that. I'm just going to keep working on my productivity, and I'll be the most productive human. I'm just going to focus on this one area because that's my wheelhouse. I'm comfortable there. I'm going to stick with my fixed mindset. And so we don't view these things as all interlinked to one another. So that's one of the things that we're trying to focus on is creating a resource that discusses all of these topics and brings them all together so that you don't have to keep shifting gears every time you want to learn about a different domain of performance.
That's kind of feel like you're talking to me in terms of, I think we all have the same thing. We focus on one thing and that's our answer. That's really, really kind of eye-opening to hear that from you there. I love hearing you use the word friction, whether it's working out or jumping in a cold plunge that you have to cool off and there's your friction and not getting in instead of having a chiller or something like that. There's friction in our everyday lives to allow us to do things we want to do. One of those, again, is information. Information overload, the internet, it's there, it's real. There's thousands, if not more, podcasts teaching people to improve in certain aspects, but you guys working to bring them all to one area is really, really awesome. Why is it so important for you as kind of a medical professional to give people a place to find information on a number of different topics? Is it something that you've always been passionate about? Is human performance? And kind of getting past that, the information that isn't so accurate. You are someone who knows this, you've studied it. Putting yourself out there is difficult. So what kind of pushed you to doing that?
So it is something I'm passionate about. I always have been. I love it. I mean, this is the thing. Like for me, if people ask, what my hobby is, I don't play much golf, and I don't have a lot of personal hobbies. I don't fish as much as I wish I could, and like this is the thing that I love doing. If I get free time, this is what I work on. Like I love it. So I'm incredibly passionate about it, and I always have been. But what's really encouraged me to bring this together is that I feel like the world needs this desperately right now.
Yeah.
And I've been blessed to be in a situation where I've worked with some unbelievably amazing people. We mentioned Nick Paparesta and others here, and I've had the chance to work with professional athletes, those who take care of professional athletes, leaders, CEOs. And at the Mayo Clinic, I mean, I'm surrounded by thousands of brilliant minds and world experts.
Sure.
And I've learned so much from them. And I feel like the world needs access to that knowledge. And that's part of what I'm wanting to do. And I've also seen so many incredibly talented people not reach their full potential because they burned out or they didn't recognize the holes in their behavior and their actions. And so I've seen so many people that could have done more had they had the right sort of formula and structure behind it. And it's heartbreaking to watch people not reach their full potential when they didn't have the resources. So all those things have kind of brought me to want to put this thing together. And honestly, I've tried not to do it I've been thinking about this for years, and I've got enough going on. So I tried not to do it for years and just kept saying no. And then finally I realized, no, this is something that I really feel passionate about. I think it needs to be done. So we've got a long-term plan with it. And right now it started as a podcast, just to get the information out. But there's a longer term plan where we're looking to build a curriculum that's available to people to go in and create their own sort of customizable human optimization program, where my hope is that eventually you can go in and say, okay, what you need, Sam, is different than the stuff I need to be working on. So you and I shouldn't be going to the exact same course. We should be able to customize it and say, actually, all right, I'm good at these 2 areas, but these other 8 I want to work on. So let me check all the boxes next to the things that I struggle with personally, that I want to get better at, that are important for my job. So you create your own sort of customized path through this. And we're going to be doing a lot of exciting things over the coming years in this space. So I'm very, very excited about it.
Yeah, it's awesome. And for those who haven't listened, there's episodes. I think the most recent episode I listened to was Understanding the Basics of Sleep. You guys talk about processed foods. And with that one, there's so much misinformation out there that I think you guys are an awesome source of knowledge. Burnout in the workplace. There's so much that you guys cover in one place, which I think is amazing because I still can visualize myself searching on the podcast for XYZ or jump into this one or the other one. So it's cool to have all that in one place with real credible hosts like yourself. Real quick, Dr. Camp, let people know where they can find that podcast. Is it on all platforms? Give a little information so our listeners can get to that.
Yeah, so podcast is out now. New episodes are coming out every Wednesday. It's you can find it wherever you listen to your podcast. So Apple Music, Spotify, whatever you like, Podbean, whatever you like. You can also there's a website that you can go to. It's ce.mayo.edu/optimize. So that has all the episodes listed there. We're also putting them up on YouTube as well. So if you like to watch them, you can find it on YouTube. So all those are great options, or you just Google Mayo Clinic Human Optimization Project and it'll pop up.
Awesome. And we will link the link to your podcast and the Human Optimization Project in our show notes, so any listeners can just click directly from there. Again, I encourage everybody to go listen just from a credible source to learn so much different information is hugely important. Well, Dr. Camp, we really appreciate your time. I know you're extremely busy with the kids and work and all that good stuff, but we wish you and all the staff over at the Minnesota Twins nothing but the best of luck the rest of the season.
Great. Thank you so much for having me. It was a real joy. Appreciate all that you're doing, Sam.
Thank you for listening to the Inside Athletic Training Podcast. For more information about PBATS and athletic training, visit pbats.com. See you next time.